It's Friday, September 4th, and time for your Barbados Today morning news update. A proposal that would see governments provide financing for the tourism sector from the international reserves to help keep thousands of hotel workers employed is currently in the works. After a lengthy meeting with hotel workers on Thursday, officials told members of the media they were hoping to start rolling out the plan in another month once Cabinet approves it. Professor Avinash Prasad, who is the Special Economic Advisor to the government, is on the team developing the program.
On a plan that will give people, firms, a genuine choice. Either they go down the severance route, that is the route that they choose, or if they wish to re-engage workers, re-employ workers, we will help them do that. So the plan is around that, and we're focusing on re-engaging workers. So that workers will have a choice. Workers will see not a chasm, but either severance and remuneration with severance. And we remember that after the amendment we made to the Severance Act, there will be an expedited severance process. Either that or re-engagement. And when speaking to the workers today, really there was a lot of commitment. People want to get back to work. They don't want to stay at home. Even if there was funding, people want to get back to work and start back their lives. And the plan is about how we do that over the next few weeks.
He said while the key component of the plan was to re-engage the workers, there were several priority areas for investment, including renewable energy, changing the value chain, greater integration of the agriculture and hotel sectors, and the settlement of outstanding statutory debt for small hotels.
We could not do this if we had not built up substantial reserves. You will remember that back in February 2018, we had 3 weeks of import cover. We could not do the plan that we're talking about with the workers today. We could not do this plan in February 2018. Today we have 30 weeks of import cover, $2.1 billion. And why do you have reserves? You have reserves for a once in 100-year global pandemic. So we are going to engage with our reserves to try and find a way of reopening our economy, re-engaging our workers with something real to do, real upskilling, real investment.
Barbados' ambassador to CARICOM, David Commission, has chided some regional governments for refusing to accept stranded citizens during the COVID-19 pandemic. He voiced the criticism as president of the Barbados Alliance to End Homelessness, Kima Safri, noted that a growing number of CARICOM nationals and other non-nationals have been seeking shelter. In an interview with Barbados Today, Commission called for member states to adopt the Mia Mottley-led administration's model, which is committed to accepting all Barbadians. Safri, meanwhile, described the last few months as a trying time in which many more non-nationals have been asking for assistance.
So it has been a trying time for us. It has pushed us to another limit, but we are seeing the numbers, and the numbers are coming. We're seeing a lot more foreigners in terms of persons that have not been able to go back to their country. They are coming. We are seeing people from far as Haiti, as far as Guyana, and different parts of Jamaicans, different parts of the Caribbean that are coming here, U.S. Citizens as well, coming here seeking to use our shelters. And some of these, well, all of these persons that have come are not accustomed to that. They're not accustomed to shelters. They're not accustomed to rules of where you can sleep and where you can't sleep, what time you have to get it. So that is pulling on the society as well. Not only that, you have the locals, but you have the persons that are from different countries. And we understand the situation, we understand the thing. And I do echo that same statement with you, where we definitely need the social services, need the social partnership, need the government to work closer.
The National Union of Public Workers says it is seeking the least embarrassing way of dealing with retired General Secretary Roslyn Smith, who continues to report for duty. NUPW President Akani McDowell said he and Acting General Secretary Delcia Burke are working together to try to resolve the situation, which saw Smith turning up at Union headquarters on Wednesday and Thursday, insisting she is still General Secretary.
Well, the first thing is for us to try to resolve it amicably. Failing that, we may have to seek further advice, either from our internal organs or from our legal counsel. But the aim is for us not to cause any embarrassment to Sister Smith or to exacerbate the existing situation.
There's regional and international news after this short break.
Barbados Today, news you can trust.
To news from our regional neighbors now, Hurricane Nana moved across southern Belize on Wednesday night into Thursday, causing less damage than expected. According to this report from Channel 5 Belize, there were no deaths and the destruction to property was not extensive.
If you live in an area that is not flood prone, then maybe the impacts to your area might be minimal. But for those who live in flood prone areas or for those whose housing might not have been strong enough, their impacts would vary. So weak is relative based on your exposure and also your vulnerability to. But in terms of the storm, it was a minimal Category 1 hurricane, and it was a very compact and small storm. Most of the significant rainfall and thunderstorm activity were located south of Belize City and in the general area of the storm. And also the extent of the hurricane and also tropical storm force winds didn't extend out much farther from the center. It was around 70 miles from the center. So it was a very small and compact storm, hence the reason other areas such as the north did not experience significant wind and also rainfall from the passage of the hurricane.
And finally, healthcare workers are especially vulnerable to COVID-19 in the region of the Americas. So disclosed the director of the Pan American Health Organization, Dr. Caricia Etienne, who said that the region has the highest number of healthcare workers infected with coronavirus in the world. She said that data showed that nearly 570,000 healthcare workers across the region have fallen ill and more than 2,500 have succumbed to the virus.
Based on this data, to date, we have the highest number of healthcare workers infected in the world. In Canada, health workers represent more than a quarter of all reported COVID-19 cases, while in the US and Mexico, which have some of the highest case counts in the world, health workers represent 1 in every 7th case. In fact, the US and Mexico account for nearly 85% of all COVID deaths among healthcare workers in our region. Women, who are the majority of our health workforce, have been disproportionately affected. Nearly 3/4 of health workers diagnosed in our region with COVID-19 are women. These numbers are alarming, and they beg the question, why are so many health workers becoming infected? When we look across our region, we see a few patterns that can help us answer this question. As countries scrambled to respond to the virus, many health workers were redirected to the outbreak response without sufficient training to protect themselves as they were treating COVID-19 patients.
That's news. But for the very latest, visit us at www.barbadostoday.bb. You can also subscribe to our e-paper, email updates, or like us on Facebook, and sign up for our breaking news alerts via WhatsApp. We're also on Izumi Media in bus terminals, as well as screenplay at supermarkets and gas stations near you. And you can also hear us on Mix 96.9 FM and Capital Media HD 99.3 FM.